Question 1. Process analysis reveals that an adolescent athlete presents with concerns about energy levels, recovery, and body composition, alongside subtle behavioral changes around food and a history of restrictive dieting during previous sports seasons. The Certified Nutrition Specialist, CNS, is tasked with developing a nutrition plan. Which of the following represents the most appropriate and ethically sound initial approach? Option A. Focus exclusively on macronutrient timing and supplementation to boost athletic performance, deferring any discussion of eating behaviors or body image until after the competitive season concludes. Option B. Immediately implement a strict, performance-focused meal plan designed to optimize body composition and energy availability, assuming the behavioral changes are solely related to training intensity. Option C. Provide general education on healthy eating for athletes and encourage the adolescent to self-monitor their food intake and mood, without further intervention unless the situation escalates significantly. Option D. Conduct a comprehensive nutritional assessment focusing on energy needs, macronutrient and micronutrient intake, hydration, and recovery strategies, while simultaneously screening for disordered eating behaviors and initiating a referral to a mental health professional specializing in eating disorders if concerns are identified. The correct answer is D. Conduct a comprehensive nutritional assessment focusing on energy needs, macronutrient and micronutrient intake, hydration, and recovery strategies, while simultaneously screening for disordered eating behaviors and initiating a referral to a mental health professional specializing in eating disorders if concerns are identified. Explanation: this scenario is professionally challenging because it requires the Certified Nutrition Specialist, CNS, to navigate the complex nutritional needs of an adolescent athlete while simultaneously addressing potential disordered eating behaviors, all within the scope of practice and ethical guidelines governing the profession. The adolescent's rapid growth and development, coupled with the demands of sports, create a delicate balance where nutritional interventions must be both supportive of performance and protective of health, avoiding any actions that could exacerbate or trigger disordered eating. Careful judgment is required to differentiate between typical adolescent eating patterns and those indicative of a disorder, and to intervene appropriately without overstepping professional boundaries. The correct approach represents best professional practice because it prioritizes a holistic, client-centered, and evidence-based strategy. It involves a comprehensive assessment that considers the athlete's training regimen, energy expenditure, micronutrient status, and psychological well-being. Crucially, it recognizes the limitations of the CNS's scope of practice regarding the diagnosis and treatment of eating disorders, necessitating a referral to a qualified mental health professional or a multidisciplinary team. This approach aligns with ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by ensuring the adolescent receives appropriate care for all aspects of their health. It also adheres to the regulatory framework by operating within the defined scope of practice for a CNS, which emphasizes nutrition assessment, intervention, and education, but not the direct medical or psychological treatment of complex mental health conditions. An incorrect approach that focuses solely on performance enhancement without addressing potential disordered eating behaviors is a significant regulatory and ethical failure. This oversight could lead to the exacerbation of an eating disorder, causing severe physical and psychological harm, which violates the principle of non-maleficence. Furthermore, it demonstrates a lack of comprehensive assessment and a failure to act in the client's best interest. Another incorrect approach that involves attempting to diagnose or treat a suspected eating disorder without appropriate referral is a direct violation of the CNS scope of practice and regulatory guidelines. This constitutes practicing outside one's professional expertise and could lead to inappropriate interventions, delaying or hindering access to specialized care, and potentially causing harm. It also fails to uphold the ethical responsibility to collaborate with other healthcare professionals when necessary. A third incorrect approach that involves providing generic, one-size-fits-all dietary advice without a thorough assessment of the individual adolescent's unique needs, training load, and potential psychological factors is also professionally unacceptable. This approach lacks the individualized care expected of a CNS and could inadvertently contribute to disordered eating patterns by imposing restrictive or unbalanced dietary recommendations. It fails to meet the standard of care and the ethical obligation to provide personalized, evidence-based nutrition guidance. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough and individualized assessment, gathering information on dietary intake, training, growth, energy levels, and psychosocial factors. 2. Identify any red flags or concerns related to disordered eating patterns, recognizing that these can be subtle and may overlap with intense athletic training. 3. Consult relevant professional guidelines and ethical codes to understand the scope of practice and responsibilities. 4. If disordered eating is suspected or confirmed, prioritize referral to a qualified mental health professional or a multidisciplinary eating disorder treatment team. 5. Collaborate with other healthcare providers involved in the adolescent's care to ensure a coordinated and comprehensive approach. 6. Provide evidence-based nutrition support within the CNS scope of practice, focusing on promoting a healthy relationship with food, optimizing nutrient intake for growth and performance, and addressing any identified nutritional deficiencies, while respecting the ongoing treatment for any disordered eating. 7. Continuously monitor the adolescent's progress and adjust nutrition recommendations as needed, always in conjunction with the broader treatment plan. Question 2. System analysis indicates a certified nutrition specialist is reviewing dietary intake data for a client using specialized software. The software has generated a detailed report of macronutrient and micronutrient consumption. The CNS must now interpret this data to assess the client's dietary adequacy and provide guidance. Which of the following represents the most appropriate and professionally responsible approach for the CNS to take in interpreting this nutrient data? Option A. Accept the software's default interpretation of the nutrient data, assuming it accurately reflects the client's nutritional status, and then suggest minor adjustments based on the client's stated food preferences. Option B. Compare the client's reported intake of all essential vitamins and minerals against the current dietary reference intakes, dry, established by the Food and Nutrition Board of the National Academies of Sciences, Engineering, and Medicine, considering the client's individual demographic factors, and then formulate recommendations to address any identified shortfalls or excesses. Option C. Focus primarily on the percentage of calories derived from carbohydrates, proteins, and fats, as these are the most significant components of a healthy diet, and adjust recommendations based on general public health advice for balanced eating. Option D. Prioritize the client's expressed desire to follow a specific popular diet trend, even if the software analysis reveals significant deviations from the DRIs for certain micronutrients, and provide advice that aligns with the trend's principles. The correct answer is B. Compare the client's reported intake of all essential vitamins and minerals against the current dietary reference intakes, dry, established by the Food and Nutrition Board of the National Academies of Sciences, Engineering, and Medicine, considering the client's individual demographic factors, and then formulate recommendations to address any identified shortfalls or excesses. Explanation. This scenario presents a common challenge for certified nutrition specialists, CNS, in the United States, interpreting and applying complex dietary data to assess a client's nutritional status. The professional challenge lies in moving beyond simply generating a report from dietary analysis software to providing meaningful, actionable insights that align with established dietary recommendations and regulatory guidelines. Careful judgment is required to ensure the analysis is accurate, ethically sound, and beneficial to the client's health outcomes. The correct approach represents best professional practice because it emphasizes a comprehensive and client-centered interpretation of the data. A CNS must not only understand the output of the software, but also critically evaluate it against the client's individual needs, health status, and goals. This involves comparing the client's intake to the dietary reference intakes, dry, as established by the Food and Nutrition Board of the National Academies of Sciences, Engineering, and Medicine, which are the primary scientific basis for federal food, nutrition, and health policy in the United States. This approach ensures that the assessment is grounded in evidence-based recommendations and is tailored to the individual, fulfilling the CNS's ethical obligation to provide competent and individualized care. An incorrect approach that solely relies on the software's default interpretation or focuses only on macronutrient percentages without considering micronutrient adequacy or comparison to DRIs fails to meet professional standards. Such an approach risks overlooking critical nutrient deficiencies or excesses, potentially leading to suboptimal health outcomes. Ethically, It is a failure to provide a thorough and individualized assessment as expected of a CNS. Another incorrect approach that prioritizes a client's subjective preferences over objective data, without a structured plan to address potential nutritional gaps, is also professionally unacceptable. While client preferences are important, a CNS must guide clients toward nutritionally sound choices. Ignoring significant deviations from recommended intakes without a strategy to mitigate them is a dereliction of professional duty. A further incorrect approach that focuses on comparing the client's intake to generalized, healthy eating guidelines without referencing specific, evidence-based recommendations like the DRIs is insufficient. While general guidelines are useful, the CNS credential implies a deeper level of expertise in applying specific, scientifically validated dietary recommendations. This approach lacks the precision and scientific rigor expected. The professional decision-making process for similar situations should involve a systematic approach. 1. Data acquisition and validation. Ensure the dietary data collected is accurate and representative of the client's typical intake. 2. Software analysis. Utilize dietary analysis software to generate a comprehensive nutrient profile. 3. Critical interpretation. Go beyond the software's output. Analyze macronutrient and micronutrient intake, identifying potential shortfalls or excesses. 4. Comparison to standards. Compare the client's intake to the relevant dietary reference intakes, DRI, for their age, sex, and life stage. 5. Client contextualization. Integrate the nutrient data with the client's health history, lifestyle, goals, and preferences. 6. Actionable recommendations. Develop personalized, evidence-based recommendations that address identified nutritional gaps and support the client's health objectives. 7. Ethical and regulatory adherence. Ensure all assessments and recommendations comply with the scope of practice for CNS professionals in the U.S. and ethical guidelines. Question 3. The performance metrics show a significant increase in client inquiries regarding the application of genetic testing for personalized nutrition plans. A certified nutrition specialist, CNS, is presented with a client's genetic report that indicates a variation in a gene known to influence folate metabolism. The CNS needs to determine the most appropriate and ethically sound approach to integrate this information into a nutrition care plan. Which of the following represents the best professional practice? Option A. Interpret the genetic variation as a direct cause of a specific nutrient-related disease and refer the client to a physician for diagnosis and treatment, without providing any nutritional guidance. Option B. Recommend specific dietary adjustments and potentially targeted supplementation based on the identified genetic variation, while clearly explaining that this is one factor among many influencing folate status and overall health, and that further assessment of current dietary intake and lifestyle is necessary. Option C. Focus solely on the genetic report, recommending a drastic reduction in foods containing folic acid and advising the client to avoid all B vitamins until further genetic analysis can be completed. Option D. Advise the client that the genetic variation definitively indicates a lifelong deficiency in folate and prescribe a high-dose folate supplement regimen to prevent future health complications. The correct answer is B. Recommend specific dietary adjustments and potentially targeted supplementation based on the identified genetic variation, while clearly explaining that this is one factor among many influencing folate status and overall health, and that further assessment of current dietary intake and lifestyle is necessary. Explanation. Scenario analysis. This scenario is professionally challenging because it involves interpreting complex genetic information and translating it into actionable, personalized nutrition recommendations. The certified nutrition specialist, CNS, must navigate the ethical considerations of genetic testing, ensure client understanding, and adhere to the scope of practice. The challenge lies in balancing the potential benefits of nutrigenetics with the risks of overinterpretation, misapplication, and potential client anxiety or misinformed decision-making. CNS must also consider the evolving nature of genetic research and the limitations of current scientific understanding. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and client-centered methodology. It acknowledges that genetic predispositions are only one factor influencing health, and that environmental, lifestyle, and behavioral factors are equally, if not more, important. This approach emphasizes the CNS's role in providing education, facilitating informed consent, and integrating genetic insights within a broader nutritional assessment. It aligns with the ethical principles of beneficence, acting in the client's best interest, non-maleficence, avoiding harm, and autonomy, respecting the client's right to make informed decisions. Specifically, it adheres to the ethical guidelines for genetic testing and counseling, which mandate clear communication of limitations, potential implications, and the need for professional interpretation. Incorrect approach is analysis, an approach that solely focuses on genetic variations to dictate specific nutrient dosages or eliminate entire food groups without considering the client's current dietary intake, lifestyle, medical history, and psychosocial factors represents a significant regulatory and ethical failure. This oversimplification can lead to inappropriate dietary interventions, potential nutrient deficiencies or excesses, and undue client distress. It fails to meet the standard of care for personalized nutrition, which requires a holistic assessment. Ethically, it violates the principle of non-maleficence by potentially causing harm through misguided recommendations. It also fails to uphold the client's autonomy by not adequately educating them about the nuances and limitations of genetic information in nutrition. Another incorrect approach would be to provide definitive prognoses or diagnoses based solely on genetic test results, implying a deterministic outcome for nutrient-related diseases. This is a misrepresentation of the current scientific understanding of nutrigenetics, where genetic variations often confer predispositions rather than certainties. This approach oversteps the scope of practice for a CNS, venturing into diagnostic territory reserved for physicians. It also creates a false sense of certainty for the client, potentially leading to anxiety or a neglect of modifiable lifestyle factors. Regulatory bodies and professional organizations emphasize that genetic information should be used for risk assessment and personalized guidance, not for definitive predictions of disease. A third incorrect approach involves recommending specific supplements or dietary changes based on a single genetic marker, without considering the broader genetic profile, gene-nutrient interactions, or the client's overall health status. This reductionist view ignores the complexity of biological systems and the multifactorial nature of nutrient metabolism and disease development. It can lead to unnecessary supplement use, financial burden for the client, and potential adverse effects. Ethically, it fails to provide evidence-based recommendations and may exploit client trust by offering simplistic solutions to complex health issues. Professional reasoning. Professionals should approach nutrigenetics by first conducting a thorough client assessment that includes dietary history, lifestyle, medical history, and personal health goals. Genetic testing should be considered as one piece of data within this comprehensive picture. Informed consent is paramount, ensuring the client understands what the test can and cannot reveal, its limitations, and the potential implications. Recommendations should be evidence-based, integrating genetic insights with established nutritional science and considering the client's unique context. Continuous professional development in the rapidly evolving field of nutrigenetics is also crucial to maintain competence and provide the highest standard of care. Question 4. Process analysis reveals a certified nutrition specialist, CNS, is consulting with a client who reports experiencing frequent fatigue, increased thirst, and unexplained weight loss over the past few months. The client also notes occasional blurred vision and increased hunger. The CNS has gathered a detailed dietary history, which shows a high intake of refined carbohydrates. Considering the potential for a metabolic disorder related to carbohydrate metabolism, what is the most appropriate initial action for the CNS? Option A. Advise the client that their symptoms are likely due to poor dietary choices and suggest increasing fiber intake. Option B. Immediately implement a low-carbohydrate diet to manage potential insulin resistance. Option C. Refer the client to a physician for medical evaluation and diagnosis. Option D. Recommend a comprehensive panel of blood tests for the client to perform at home. The correct answer is C. Refer the client to a physician for medical evaluation and diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge for certified nutrition specialists, CNS, where a client exhibits symptoms suggestive of a metabolic disorder, specifically related to carbohydrate metabolism. The professional challenge lies in differentiating between a potential medical diagnosis, requiring physician referral and nutritional management strategies that fall within the CNS scope of practice. Misinterpreting symptoms or overstepping professional boundaries can lead to patient harm and regulatory noncompliance. The CNS must exercise careful judgment to ensure client safety and adhere to ethical guidelines. Correct approach analysis. The correct approach involves recognizing the limitations of the CNS scope of practice regarding medical diagnosis. The primary responsibility is to gather comprehensive client information, including detailed dietary history, symptomology, and current medical status. Based on this information, the CNS should identify potential red flags that warrant medical evaluation. Referring the client to a physician for diagnosis and medical management is the most appropriate and ethically sound action when a potential underlying medical condition is suspected. This aligns with the principle of do no harm and ensures the client receives appropriate medical care. The CNS can then collaborate with the physician to develop a supportive nutritional plan once a diagnosis is established and medical treatment is underway. This collaborative approach is supported by professional practice standards that emphasize interdisciplinary care. Incorrect approaches analysis. One incorrect approach involves attempting to diagnose the condition based solely on the presented symptoms and dietary patterns. This is a direct violation of the CNS scope of practice, as diagnosis of medical conditions is reserved for licensed physicians. Ethically, this constitutes practicing outside one's expertise and could lead to delayed or incorrect medical treatment for the client. Regulatory frameworks for CNS professionals strictly define their scope and prohibit medical diagnosis. Another incorrect approach is to immediately implement aggressive dietary interventions without a confirmed diagnosis or physician consultation. While nutrition plays a role in managing metabolic disorders, initiating significant dietary changes without understanding the underlying pathology could exacerbate the condition or mask crucial diagnostic signs. This approach disregards the need for medical assessment and could be considered negligent, failing to uphold the standard of care expected of a CNS. A third incorrect approach is to dismiss the client's symptoms as solely lifestyle-related without considering potential underlying medical causes. This demonstrates a lack of thorough assessment and could lead to a misdiagnosis of a serious condition. Ethically, it fails to adequately address the client's health concerns and could result in harm due to delayed medical intervention. Professional reasoning. When faced with a client presenting symptoms suggestive of a metabolic disorder, a CNS should follow a structured decision-making process. This process begins with a comprehensive assessment, including a detailed history and symptom review. The CNS must then critically evaluate the findings against their scope of practice. If the symptoms point towards a potential medical diagnosis that requires medical intervention or diagnosis, the immediate and ethically mandated step is to refer the client to a qualified physician. Following the referral, the CNS can offer supportive nutritional guidance within their scope in collaboration with the medical team. This ensures client safety, adherence to professional boundaries, and optimal health outcomes. Question 5. The control framework reveals that a certified nutrition specialist, CNS, is consulting with a client who expresses a desire to boost their overall health and energy levels through supplementation. The client has no diagnosed deficiencies but is interested in a comprehensive vitamin regimen. Considering the potential for vitamin toxicity, particularly with fat-soluble vitamins, which of the following approaches best aligns with the CNS's professional responsibilities and regulatory guidelines for safe and effective nutrition practice? Option A. Conduct a thorough dietary assessment to identify any actual nutrient shortfalls. Explore lifestyle factors contributing to low energy, and only recommend specific, evidence-based supplements at appropriate dosages if dietary intake is insufficient or a clinical need is identified. Option B. Suggest a regimen of high-dose fat-soluble vitamin supplements, ADE, to ensure the client has an abundant supply, as these are essential for long-term health. Option C. Recommend a high-potency, broad-spectrum multivitamin and mineral supplement, emphasizing its role in filling potential nutrient gaps and enhancing energy. Option D. Advise the client to select a popular, energy-boosting supplement from the market based on its marketing claims and readily available consumer reviews. The correct answer is C. Recommend a high-potency, broad-spectrum multivitamin and mineral supplement, emphasizing its role in filling potential nutrient gaps and enhancing energy. Explanation. The control framework reveals that a certified nutrition specialist, CNS, must navigate complex client needs while adhering to strict professional and regulatory standards. This scenario is professionally challenging because it requires the CNS to balance providing comprehensive nutritional guidance with the potential for vitamin toxicity, especially when recommending supplementation. The CNS must exercise careful judgment to ensure recommendations are evidence-based, individualized, and safe, avoiding over-reliance on supplements without a clear clinical indication. The correct approach represents best professional practice because it prioritizes a thorough assessment of the client's dietary intake and lifestyle before considering supplementation. This aligns with the CNS credential's emphasis on individualized, evidence-based nutrition care. By focusing on dietary sources first and only recommending supplements when necessary and at appropriate dosages, the CNS minimizes the risk of vitamin toxicity, particularly with fat-soluble vitamins which can accumulate in the body. This approach is ethically sound, as it places the client's well-being and safety above all else, and is consistent with regulatory guidelines that emphasize the importance of a holistic and evidence-based approach to nutrition practice. An incorrect approach that focuses solely on recommending a broad-spectrum vitamin supplement without assessing current intake or specific deficiencies fails to adhere to the principle of individualized care. This could lead to unnecessary supplementation, increased risk of toxicity, and potentially mask underlying health issues. Ethically, it deviates from the duty of care by not performing a complete assessment. Another incorrect approach that emphasizes high-dose supplementation for perceived general wellness without considering the client's specific needs or potential for toxicity, is also professionally unacceptable. This demonstrates a lack of understanding of vitamin metabolism and toxicity thresholds, particularly for fat-soluble vitamins. It also violates the principle of do no harm by exposing the client to unnecessary risks. A further incorrect approach that relies heavily on anecdotal evidence or marketing claims for specific supplements, rather than evidence-based research, is professionally unsound. This bypasses the rigorous scientific foundation expected of a CNS and can lead to ineffective or harmful recommendations. It is a failure to uphold professional standards and may contravene guidelines regarding the responsible promotion and use of dietary supplements. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive client assessment, including detailed dietary history, lifestyle, medical history, and current symptoms. 2. Identify specific nutritional needs or deficiencies based on the assessment and evidence-based guidelines. 3. Prioritize obtaining nutrients from whole foods whenever possible. 4. If supplementation is indicated, select specific nutrients, dosages, and forms based on scientific evidence and the client's individual needs, carefully considering potential for toxicity. 5. Educate the client about the rationale for supplementation, potential benefits, risks, and the importance of ongoing monitoring. 6. Regularly reassess the client's status and adjust recommendations as needed. Question 6. Governance review demonstrates that a certified nutrition specialist, CNS, is developing a dietary plan for a client experiencing fatigue and muscle weakness. The client's current diet is moderately low in magnesium and iron, and the CNS is considering recommendations to address these potential deficiencies. Considering the functions, sources, deficiency symptoms, and metabolic roles of major and trace minerals and their potential interaction, which of the following approaches best aligns with the CNS's professional responsibilities and regulatory framework in the United States? Option A. Prescribe a high-dose iron supplement to immediately address the suspected iron deficiency, as iron is crucial for energy metabolism and fatigue is a primary symptom. Option B. Recommend a dietary plan that emphasizes magnesium-rich foods like leafy greens and nuts, and iron-rich foods such as lean meats and legumes, while also advising the client to monitor for symptoms of both magnesium and iron deficiency, and to report any changes. Option C. Focus solely on increasing the client's intake of magnesium-rich foods, as magnesium is directly involved in muscle function and fatigue, can be a prominent symptom of its deficiency. Option D. Advise the client to take a broad-spectrum multi-mineral supplement containing a wide array of trace minerals, as this will likely cover any potential deficiencies and support overall metabolic function. The correct answer is B. Recommend a dietary plan that emphasizes magnesium-rich foods like leafy greens and nuts, and iron-rich foods such as lean meats and legumes, while also advising the client to monitor for symptoms of both magnesium and iron deficiency and to report any changes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nutrition specialist, CNS, to navigate the complex interplay of multiple minerals within a client's diet, considering their individual needs and potential interactions. The CNS must balance providing accurate, evidence-based nutritional guidance with ensuring client safety and adherence to professional standards, all while operating within the specific regulatory framework governing their practice in the United States. The challenge lies in synthesizing information about individual mineral functions, sources, deficiencies, and metabolic roles, and then applying this knowledge to a practical dietary recommendation that accounts for synergistic and antagonistic relationships between minerals. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the client's dietary intake and health status before making specific recommendations. This aligns with the CNS Code of Ethics, which emphasizes client-centered care and evidence-based practice. Specifically, it adheres to the principle of do no harm by avoiding potentially detrimental recommendations that could arise from overlooking mineral interactions. By focusing on dietary sources and considering the client's current intake, the CNS is acting within their scope of practice, which includes providing nutrition education and counseling. This approach is also consistent with the regulatory expectations for healthcare professionals in the U.S., which demand a thorough understanding of nutritional science and its application to individual health. Incorrect approaches analysis. One incorrect approach fails by making a broad recommendation for a single mineral supplement without a thorough assessment. This is a regulatory and ethical failure because it bypasses the crucial step of identifying a specific deficiency or imbalance through assessment. It risks oversupplementation, which can lead to toxicity or interfere with the absorption of other essential nutrients, violating the do no harm principle. It also fails to consider the client's existing dietary intake, potentially leading to redundant or excessive intake. Another incorrect approach is to recommend a multi-mineral supplement without understanding the client's specific needs or potential interactions. This is professionally unacceptable as it is not tailored to the individual and may provide unnecessary nutrients or doses that could be harmful or interfere with other bodily processes. It demonstrates a lack of critical analysis and personalized care, which are hallmarks of competent CNS practice. A third incorrect approach involves solely focusing on a single mineral's deficiency symptoms without considering the broader metabolic context or potential interactions with other minerals. This is a failure in deep analysis and can lead to incomplete or even counterproductive recommendations. For example, addressing iron deficiency without considering copper's role in iron metabolism could lead to an ineffective intervention. It also overlooks the possibility that symptoms might be multifactorial and not solely attributable to one mineral. Professional reasoning. Professionals should adopt a systematic approach that begins with a comprehensive client assessment, including dietary history, health status, and relevant laboratory data, if available and within scope. This assessment informs the identification of potential nutrient gaps or imbalances. Following assessment, the CNS should prioritize dietary modifications to address identified needs, considering the synergistic and antagonistic relationships between minerals. Supplementation should only be considered when dietary interventions are insufficient and based on specific, evidence-based recommendations, always accounting for potential interactions and toxicity. Continuous professional development and adherence to ethical guidelines are paramount in navigating complex nutritional scenarios. Question 7. The risk matrix shows a client presenting with elevated triglyceride levels following a high-fat meal. Considering the initial stages of lipid metabolism after digestion and absorption, which lipoprotein particle is primarily responsible for transporting dietary triglycerides from the intestine to the rest of the body. Option A, low-density lipoproteins, LDL. Option B, chylomicrons. Option C, very low-density lipoproteins, VLDL. Option D, high-density lipoproteins, HDL. The correct answer is B, chylomicrons. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified nutrition specialist, CNS. by requiring them to differentiate between two distinct yet related metabolic pathways involved in lipid processing. The challenge lies in accurately identifying the primary regulatory mechanisms and physiological roles of each pathway in response to dietary intake and hormonal signals, particularly in the context of potential metabolic dysfunction. A CNS must possess a nuanced understanding to provide evidence-based, individualized nutrition recommendations. Correct approach analysis. The correct approach accurately identifies the primary role of chylomicrons in the exogenous pathway of lipid transport, emphasizing their function in delivering dietary triglycerides to peripheral tissues and the liver. This aligns with the regulatory framework for CNS practice, which mandates a thorough understanding of nutrient metabolism and its impact on health. Best professional practice involves recognizing that chylomicrons are the initial carriers of dietary fats, and their metabolism is distinct from the endogenous pathway initiated by VLDL. This understanding is crucial for assessing and managing dyslipidemias, a core competency for CNS professionals. Incorrect approach is analysis. One incorrect approach fails to distinguish between the exogenous and endogenous lipid transport pathways. It incorrectly attributes the primary role of delivering dietary triglycerides to the liver as a key function of VLDL, overlooking the crucial role of chylomicrons in this initial phase. This demonstrates a fundamental misunderstanding of lipid metabolism, which could lead to inaccurate dietary assessments and intervention, potentially violating ethical standards of practice by providing substandard care. Another incorrect approach conflates the roles of LDL and HDL in lipid transport. It might suggest that LDL's primary function is to remove excess cholesterol from tissues, which is the role of HDL. This mischaracterization of lipoprotein function is a significant regulatory failure, as it directly impacts the ability to counsel clients on cardiovascular health and manage hyperlipidemia, a condition CNS professionals are expected to address. Providing advice based on such a misunderstanding would be a breach of professional competence. A third incorrect approach might focus solely on the catabolic process of beta oxidation, without adequately considering the transport mechanisms that deliver fatty acids to the mitochondria for this process. While beta oxidation is vital for energy production, it is downstream of absorption and transport. Failing to acknowledge the initial steps of lipid digestion, absorption, and transport leads to an incomplete understanding of the overall lipid metabolic picture, hindering effective nutritional intervention for clients with lipid-related disorders. This incomplete knowledge base could lead to recommendations that do not address the root cause of a client's metabolic issue. Professional reasoning. A CNS should approach this scenario by first recalling the distinct pathways of lipid metabolism, the exogenous pathway chylomicrons, and the endogenous pathway VLDL, idle, LDL, HDL. They should then consider the physiological context provided by the question, such as dietary intake or hormonal signals, to determine which pathway is most relevant. The decision-making process involves systematically evaluating the functions of each lipoprotein class and their respective roles in lipid transport and metabolism, ensuring that the chosen answer accurately reflects the scientific understanding required for effective client care and adherence to professional standards. Question 8. Strategic planning requires a certified nutrition specialist, CNS, to consider the integration of nutrigenomic data into personalized nutrition recommendations. When evaluating a client's genetic profile for potential nutrient interactions and epigenetic modifications, which approach best aligns with evidence-based practice and ethical professional conduct within the United States regulatory framework. Option A. Develop a personalized nutrition plan that prioritizes nutrient recommendations directly linked to specific genetic variations, while also considering the client's current health status, lifestyle, and dietary intake, and clearly communicating the scientific evidence and limitations of nutrigenomic insights. Option B. Immediately implement a comprehensive dietary overhaul based solely on the genetic predispositions identified, assuming these variations dictate optimal nutrient requirements without further clinical correlation. Option C. Provide a detailed report of the client's genetic predispositions related to nutrition, and advise them to independently research and implement dietary changes based on this information. Option D. Focus exclusively on the epigenetic modifications suggested by the genetic data, recommending specific supplements to counteract any perceived negative gene expression, without a holistic assessment of the client's overall health and diet. The correct answer is A. Develop a personalized nutrition plan that prioritizes nutrient recommendations directly linked to specific genetic variations, while also considering the client's current health status, lifestyle, and dietary intake, and clearly communicating the scientific evidence and limitations of nutrigenomic insights. Explanation: the scenario presents a professional challenge because it requires a certified nutrition specialist, CNS, to navigate the complex and evolving field of nutrigenomics while adhering to strict ethical and regulatory guidelines. The CNS must balance the potential benefits of personalized nutrition based on genetic information with the need for evidence-based practice, patient privacy, and avoiding unsubstantiated claims. Careful judgment is required to ensure that recommendations are safe, effective, and compliant with the scope of practice and relevant regulations. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that integrates genetic information with a thorough understanding of the individual's current health status, lifestyle, and dietary intake. This approach aligns with the CNS credential's emphasis on scientific integrity and client-centered care. It acknowledges that genetic predispositions are only one piece of the puzzle, and that environmental factors and individual responses play a crucial role. Furthermore, it adheres to ethical principles of informed consent and responsible communication of potential benefits and limitations of nutrigenomic testing. An incorrect approach that relies solely on genetic predispositions without considering other health factors or robust scientific evidence would be professionally unacceptable. This could lead to inappropriate or ineffective dietary recommendations, potentially causing harm or delaying necessary medical interventions. Such an approach could also violate ethical obligations to provide evidence-based care and could be seen as making unsubstantiated claims about the efficacy of specific dietary interventions based on limited genetic data, which may fall outside the scope of practice or violate advertising regulations. Another incorrect approach that involves sharing or misinterpreting genetic information without proper consent or understanding of privacy regulations would be a significant ethical and regulatory failure. This could lead to breaches of patient confidentiality and legal repercussions. The professional reasoning process for similar situations should involve a systematic evaluation of all available data, including genetic information, clinical assessments, and dietary history. Professionals must critically appraise the scientific literature supporting any nutrigenomic claims and recommendations. They should always obtain informed consent, clearly explaining the purpose, limitations, and potential outcomes of any genetic testing or nutrigenomic-based recommendations. Maintaining client confidentiality and adhering to all applicable laws and ethical codes are paramount. When in doubt, consulting with other healthcare professionals or seeking further education on the latest research and regulatory guidance is essential. Question 9. Operational review demonstrates that a client reports persistent fatigue and cognitive fog. Laboratory results indicate serum levels for a specific micronutrient are at the lower end of the reference range, though not definitively deficient. The client has also recently undergone a significant dietary change. What is the most ethically and professionally responsible course of action for the certified nutrition specialist? Option A. Advise the client to immediately begin taking a high-dose, broad-spectrum micronutrient supplement to address all potential deficiencies. Option B. Recommend a targeted short-term trial of a specific micronutrient supplement, coupled with a detailed dietary reassessment and a plan for follow-up to evaluate symptom response and laboratory values. Option C. Inform the client that their symptoms are likely unrelated to micronutrient status, given the laboratory results are not definitively deficient and focus solely on the recent dietary change. Option D. Suggest the client discontinue all micronutrient supplements they may be taking and wait for their next routine lab work to reevaluate. The correct answer is B. Recommend a targeted, short-term trial of a specific micronutrient supplement, coupled with a detailed dietary reassessment and a plan for follow-up to evaluate symptom response and laboratory values. Explanation: scenario analysis. This scenario presents a professional challenge because the certified nutrition specialist, CNS, is faced with conflicting information regarding a client's micronutrient status and a potential intervention. The client's self-reported symptom, while suggestive of a deficiency, are subjective and can be influenced by numerous factors beyond micronutrient status. The laboratory results, while objective, may not always perfectly correlate with clinical presentation, and there can be variations in lab accuracy and interpretation. The CNS must navigate the ethical imperative to provide evidence-based, client-centered care while avoiding unnecessary or potentially harmful interventions. This requires a careful balance of scientific knowledge, clinical judgment, and adherence to professional standards. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates multiple data points. This aligns with the CNS Code of Ethics, which emphasizes the importance of evidence-based practice and client well-being. Specifically, the CNS should consider the client's reported symptoms, medical history, dietary intake, and lifestyle factors. Further, a thorough review of the laboratory results, considering their limitations and potential for variability, is crucial. If the initial assessment suggests a potential micronutrient concern that cannot be definitively resolved through dietary modification alone, a targeted, short-term trial of supplementation under close monitoring, with clear objectives and reassessment criteria, is ethically and professionally sound. This approach prioritizes client safety by avoiding prolonged or unnecessary supplementation and ensures that interventions are data-driven and responsive to the client's actual needs and responses. This is consistent with the principles of responsible nutrition practice, which advocate for individualized care and a stepwise approach to intervention. Incorrect approaches analysis. Recommending a high-dose, long-term micronutrient supplement solely based on subjective symptoms, without a thorough investigation of other contributing factors or a clear plan for reassessment, is ethically problematic. This approach risks overtreatment, potential toxicity from excessive intake of certain micronutrients, and may mask underlying medical conditions. It deviates from the principle of evidence-based practice by relying heavily on anecdotal evidence without sufficient objective data or a structured plan for evaluation. Dismissing the client's reported symptoms entirely and focusing only on the laboratory results, especially if those results are borderline or not definitively indicative of a severe deficiency, is also professionally unsound. This approach fails to acknowledge the client's lived experience and can lead to a breakdown in the therapeutic relationship. It also overlooks the possibility that symptoms may be present even with lab values that are within the lower end of the reference range, or that other factors are contributing to the symptoms. Initiating a broad-spectrum micronutrient supplement without a specific rationale tied to the client's reported symptoms or laboratory findings is an indiscriminate approach. This lacks the precision and individualized care that is the hallmark of a CNS. It is not evidence-based and can lead to unnecessary expense for the client and potential imbalances if certain micronutrients are oversupplied. Professional reasoning. Professionals should adopt a systematic decision-making process. First, gather all available data, including subjective reports, objective measurements, and relevant history. Second, critically evaluate the data, considering its reliability, validity, and potential limitations. Third, formulate a differential diagnosis or a list of potential contributing factors. Fourth, develop an evidence-based plan that addresses the most likely causes, prioritizing the least invasive and safest interventions. Fifth, establish clear goals and metrics for success, and schedule regular reassessment to monitor progress and adjust the plan as needed. This iterative process ensures that interventions are appropriate, effective, and ethically sound. Question 10. Stakeholder feedback indicates a desire for more streamlined and easily interpretable dietary assessment data to inform nutrition recommendations. As a certified nutrition specialist, CNS, you are considering how to best meet this feedback while maintaining the integrity of your professional practice and adhering to the BCNS standards of practice. Which of the following approaches best balances stakeholder expectations with the requirement for a comprehensive and accurate dietary assessment? Option A. Conduct a comprehensive dietary history, incorporating questions about usual intake patterns, food preparation, and meal timing, and supplement with a brief food frequency questionnaire to capture broader trends. Option B. Rely solely on a single 24-hour dietary recall, as this provides detailed quantitative data that can be quickly analyzed. Option C. Utilize a brief food frequency questionnaire as the primary assessment tool, focusing on common food groups and nutrient intake over the past month. Option D. Prioritize a rapid dietary screening tool that can be completed in under 5 minutes to expedite the recommendation process. Correct answer is A. Conduct a comprehensive dietary history, incorporating questions about usual intake patterns, food preparation, and meal timing, and supplement with a brief food frequency questionnaire to capture broader trends. Explanation. This scenario presents a common professional challenge where a certified nutrition specialist, CNS, must reconcile conflicting stakeholder expectations with evidence-based practice and regulatory compliance. The challenge lies in balancing the desire for quick, easily digestible information from the stakeholder's perspective, with the need for accurate, comprehensive dietary assessment, which is foundational to providing effective nutrition care and adhering to professional standards. Careful judgment is required to select the most appropriate dietary assessment method that meets both the client's needs and the professional's ethical and regulatory obligations. The correct approach represents best professional practice because it prioritizes a thorough and accurate dietary assessment, which is a cornerstone of the CNS scope of practice as defined by the Board for Certification of Nutrition Specialists, BCNS, standards of practice. A comprehensive dietary history, when appropriately administered, allows the CNS to gather detailed information about usual intake patterns, food preferences, cultural influences, and potential nutrient inadequacies or excesses. This method, when combined with other assessment tools as needed, provides the most robust foundation for developing personalized nutrition recommendations and interventions, thereby fulfilling the CNS's duty of care and adhering to the BCNS Code of Ethics regarding competence and client well-being. An incorrect approach that relies solely on a brief food frequency questionnaire, FFQ, without further clarification or context, fails to meet the depth required for a comprehensive nutritional assessment. While FFQs can be useful for screening or assessing intake of specific nutrients or food groups over a longer period, they are often limited in their ability to capture the nuances of an individual's actual dietary intake, portion sizes, preparation methods, and meal timing. Relying solely on this method without acknowledging its limitations or supplementing it with more detailed inquiry could lead to inaccurate conclusions about the client's nutritional status, potentially resulting in suboptimal or even harmful recommendations. This could be considered a failure to practice competently and to act in the client's best interest, violating ethical principles. Another incorrect approach that focuses exclusively on a 24-hour recall without considering its limitations is also professionally problematic. While a 24-hour recall provides detailed information about intake on a specific day, it may not be representative of the client's usual dietary habits due to day-to-day variations. If this single recall is the sole basis for recommendations, it risks overemphasizing or underemphasizing certain foods or nutrients, leading to an incomplete or skewed understanding of the client's overall dietary pattern. This could also be seen as a failure to gather sufficient information for accurate assessment, potentially impacting the quality of care provided. Finally, an approach that prioritizes speed and ease of data collection over the accuracy and comprehensiveness of the dietary assessment would be ethically unsound. The CNS has a responsibility to employ methods that yield reliable data for informed decision-making, choosing a method primarily for its efficiency, without regard for its scientific validity or its ability to capture the necessary detail for a thorough nutritional assessment, would be a dereliction of professional duty and could compromise client safety and outcomes. The professional reasoning process for similar situations should involve a systematic evaluation of the client's needs, the purpose of the assessment, and the strengths and limitations of various dietary assessment methods. The CNS should select the most appropriate method or combination of methods that will yield the most accurate and comprehensive data for developing personalized and effective nutrition interventions, always prioritizing client well-being and adhering to professional standards and ethical guidelines. This involves critical thinking about the trade-offs between different methods and making a reasoned decision based on the best available evidence and professional judgment. Question 11. The control framework reveals that a certified nutrition specialist, CNS, is reviewing the growth trajectory of a 7-year-old child who has consistently been at the 50th percentile for weight and height. Recently, the child's weight has dropped to the 25th percentile, while their height remains at the 50th percentile. The parents express concern about this change. Which of the following represents the most appropriate initial step for the CNS in assessing this situation? Option A. Advise the parents that a drop in percentile is normal and not a cause for alarm. Option B. Focus solely on the current percentile for weight and height to determine if a nutritional deficiency exists. Option C. Review the child's complete growth history, consider the rate of growth, and conduct a detailed clinical assessment including dietary intake and family history. Option D. Immediately recommend an increase in caloric intake to address the perceived weight loss. The correct answer is D. Immediately recommend an increase in caloric intake to address the perceived weight loss. Explanation. The control framework reveals that a certified nutrition specialist, CNS, is tasked with assessing the growth and development of a pediatric client. This scenario is professionally challenging because accurately interpreting growth patterns requires more than just plotting data points. It necessitates understanding the nuances of individual growth trajectories, potential underlying health conditions, and the psychosocial context of the child and family. The CNS must apply a holistic approach, integrating objective data with subjective observations and client history, all while adhering to the ethical and regulatory standards governing the profession. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment. This involves utilizing age-appropriate growth charts, e.g., or CDC growth charts for the U.S. jurisdiction, as per the exam's implied scope, considering the child's entire growth history, and engaging in a thorough clinical interview with the caregivers. This method ensures that deviations from expected growth are identified in a timely manner and can be investigated further, potentially leading to early intervention for any underlying issues. This aligns with the ethical imperative to provide competent and evidence-based care, prioritizing the well-being of the child. An incorrect approach would be to solely focus on a single growth measurement without considering the historical trend. This fails to acknowledge that growth is a dynamic process, and a single point in time may not accurately reflect the child's overall growth trajectory. It also overlooks the possibility of temporary fluctuations or catch-up growth. Another incorrect approach would be to dismiss parental concerns about growth without a thorough investigation, potentially leading to a misdiagnosis or delayed intervention. This disregards the importance of the caregiver's observations and the holistic nature of pediatric care. A further incorrect approach would be to make definitive diagnoses or treatment recommendations based solely on growth chart data, without consulting with or referring to other healthcare professionals when indicated. This violates the scope of practice for a CNS and could lead to inappropriate care. Professionals should employ a decision-making process that begins with a thorough review of available data, including past growth records and medical history. This is followed by a detailed clinical assessment, incorporating both objective measurements and subjective information from the client and caregivers. When interpreting growth charts, the CNS must consider the child's age, sex, and any relevant medical conditions. If concerns arise, the professional should engage in further investigation, which may include additional assessments or consultations with other healthcare providers, such as pediatricians or endocrinologists, to ensure the best possible outcome for the child. Question 12. Assessment of body composition for a client presenting with a history of cardiovascular disease and a sedentary lifestyle requires careful consideration of the most appropriate methodology. Which of the following approaches best aligns with the principles of evidence-based practice and comprehensive client assessment for a certified nutrition specialist? Option A. Utilizing dual-energy X-ray absorptiometry DEXA to obtain detailed data on lean mass, fat mass, and bone mineral density, allowing for a nuanced understanding of metabolic health and regional fat distribution. Option B. Employing bioelectrical impedance analysis, BIA, as the sole assessment method, prioritizing its speed and minimal invasiveness. Option C. Relying solely on body mass index, BMI, as a primary indicator of body composition, given its ease of calculation and widespread recognition. Option D. Conducting skin fold measurements at multiple sites without considering the potential for inter-observer variability or the client's specific body fat distribution. The correct answer is A. Utilizing dual-energy X-ray absorptiometry DEXA to obtain detailed data on lean mass, fat mass, and bone mineral density, allowing for a nuanced understanding of metabolic health and regional fat distribution. Explanation. Scenario analysis. This scenario presents a common challenge for certified nutrition specialists, CNS, in a clinical setting, selecting the most appropriate and accurate body composition assessment method for a client with specific health considerations, while adhering to professional standards and ethical guidelines. The challenge lies in balancing the client's comfort, the available resources, the scientific validity of the methods, and the need for actionable data to inform personalized nutrition recommendations. A CNS must consider not only the technical aspects of each assessment, but also its interpretability and relevance to the client's overall health goals and potential contraindications. Correct approach analysis. The correct approach prioritizes a method that is scientifically validated, provides comprehensive data, and is generally considered a gold standard for body composition assessment, especially when detailed information is crucial for clinical decision-making. This method offers a more precise breakdown of lean mass, fat mass, and bone mineral content than simpler methods, allowing for a nuanced understanding of the client's health status. Its accuracy is well established in peer-reviewed literature, supporting its use in clinical practice for informed intervention planning. This aligns with the CNS credential's emphasis on evidence-based practice and the ethical obligation to provide the highest quality of care. Incorrect approaches analysis. One incorrect approach involves relying solely on a method that is highly accessible and commonly used, but lacks the precision and depth of information required for a comprehensive clinical assessment. While BMI is a useful screening tool, it does not differentiate between fat mass and lean mass, nor does it account for body fat distribution, making it insufficient for detailed clinical interpretation in many cases. Using this method alone would be a failure to adequately assess the client's body composition, potentially leading to misinterpretations and suboptimal recommendations, which is a breach of professional duty. Another incorrect approach is to select a method based primarily on convenience or cost, without fully considering its limitations for the specific client. While some methods are less expensive or easier to administer, they may not provide the necessary accuracy or detail for a thorough assessment. For instance, relying solely on skinfold measurements can be operator-dependent and may not be as accurate as other methods, especially in individuals with very high or very low body fat percentages. This can lead to inaccurate data and, consequently, inappropriate nutritional guidance, failing to meet the standard of care expected of a CNS. A further incorrect approach is to utilize a method that may have contraindications for the client's specific health status without proper consideration or consultation. For example, bioelectrical impedance analysis, BIA, can be affected by hydration status and may not be suitable for individuals with certain medical conditions or implanted medical devices. Proceeding with such a method without acknowledging these limitations or exploring alternatives would represent a failure to conduct a safe and appropriate assessment, violating ethical principles of client well-being and due diligence. Professional reasoning. When faced with selecting a body composition assessment method, a CNS should engage in a systematic decision-making process. This begins with understanding the client's health history, goals, and any potential contraindications for specific assessment techniques. Next, the CNS should evaluate the scientific validity, accuracy, and comprehensiveness of available methods in the context of the client's needs. The chosen method should align with evidence-based practice and the professional standards of the CNS credential. Finally, the CNS must be able to interpret the results accurately and integrate them into a personalized nutrition plan, ensuring that the assessment serves a clear clinical purpose and contributes to improved client outcomes. This process emphasizes a client-centered, evidence-based, and ethically sound approach to practice. Question 13. Comparative studies suggest that individualized nutritional interventions significantly impact maternal and infant outcomes in high-risk pregnancies. A 32-year-old client, currently 28 weeks pregnant, has a history of preeclampsia in a previous pregnancy and has recently been diagnosed with gestational diabetes. She expresses concern about her diet and how it will affect her baby's health and her own. She is also interested in breastfeeding, but is unsure if it will be possible given her medical history. As a certified nutrition specialist, CNS, what is the most appropriate initial approach to managing this client's nutritional needs? Option A. Recommend a high-protein, low-sodium diet to mitigate preeclampsia risk, without specific carbohydrate recommendations for gestational diabetes, and advise her to consult a lactation consultant post-delivery for infant feeding. Option B. Develop a comprehensive, individualized nutrition plan that addresses both gestational diabetes management and the increased risk associated with a history of preeclampsia, in collaboration with her obstetrician, and provide education on optimal infant feeding, including breastfeeding preparedness. Option C. Provide a standardized low-carbohydrate meal plan commonly used for gestational diabetes, focusing solely on blood glucose control, and defer infant feeding discussions until after delivery. Option D. Focus primarily on weight management strategies for the remainder of the pregnancy, as this is a key factor in both gestational diabetes and preeclampsia, and postpone detailed dietary planning until her next prenatal visit. The correct answer is B. Develop a comprehensive, individualized nutrition plan that addresses both gestational diabetes management and the increased risk associated with a history of preeclampsia, in collaboration with her obstetrician, and provide education on optimal infant feeding, including breastfeeding preparedness. Explanation. Scenario analysis. This scenario presents a common yet complex challenge for a certified nutrition specialist, CNS. A client with a history of preeclampsia and a current diagnosis of gestational diabetes requires comprehensive nutritional management during pregnancy. The professional must integrate knowledge of maternal physiology, specific pregnancy-related conditions, and infant feeding recommendations, while adhering to the ethical and regulatory standards governing the CNS profession in the United States. The challenge lies in tailoring evidence-based recommendations to an individual with multiple risk factors, ensuring both maternal and fetal well-being, and navigating potential communication with other healthcare providers. Correct approach analysis. The correct approach prioritizes a holistic, individualized assessment and intervention plan. This involves gathering detailed dietary history, understanding the client's current lifestyle, and collaborating with her obstetrician to ensure the nutritional plan aligns with medical management. The CNS should focus on evidence-based strategies for managing gestational diabetes, e.g., carbohydrate counting, appropriate macronutrient distribution, and addressing the increased risk associated with a history of preeclampsia, e.g., monitoring sodium intake, ensuring adequate micronutrient status. Furthermore, providing education on optimal infant feeding, including breastfeeding benefits and potential challenges, is crucial. This approach aligns with the CNS scope of practice, which emphasizes the application of nutritional science to promote health and prevent disease, and adheres to ethical principles of beneficence, non-maleficence, and client autonomy. The CNS is expected to practice within their defined competencies and collaborate with other healthcare professionals when necessary, as outlined by the Board for Certification of Nutrition Specialists, BCNS, Standards of Professional Practice. Incorrect approach is analysis. One incorrect approach would be to solely focus on general pregnancy nutrition guidelines without acknowledging the client's specific medical history. This fails to address the heightened risks associated with gestational diabetes and a history of preeclampsia, potentially leading to suboptimal maternal and fetal outcomes. Ethically, this represents a failure of beneficence and non-maleficence by not providing the most appropriate and individualized care. Regulatory-wise, it could be seen as practicing outside the scope of providing specialized care for high-risk pregnancies. Another incorrect approach would be to recommend a very restrictive diet for gestational diabetes without considering the client's overall nutritional needs for pregnancy or her previous experience with preeclampsia. Such a restrictive approach could lead to nutrient deficiencies or unintended weight loss, which can be detrimental during pregnancy. This would violate the principle of providing balanced and adequate nutrition and could be considered a failure to adequately assess and address the client's unique physiological state. A third incorrect approach would be to provide infant feeding advice that is not tailored to the client's potential breastfeeding capacity or personal choices, or to ignore the importance of prenatal nutrition in preparing for lactation. This demonstrates a lack of comprehensive care that extends beyond the prenatal period. Ethically, it fails to fully support the client's journey into motherhood. Professional reasoning. When faced with a client like this, a CNS should first establish a strong collaborative relationship with the client and her obstetrician. The decision-making process should involve 1. Thoroughly assessing the client's current health status, medical history, and lifestyle. 2. Reviewing current evidence-based guidelines for managing gestational diabetes and preventing recurrence of preeclampsia in pregnancy. 3. Developing an individualized nutrition intervention plan in consultation with the client and her physician, focusing on achievable goals. 4. Providing ongoing monitoring and support, adjusting the plan as needed. 5. Educating the client on all aspects of nutrition relevant to her pregnancy and postpartum period, including infant feeding. This systematic, evidence-based, and collaborative approach ensures the highest standard of care and adherence to professional and ethical obligations. Question 14. The efficiency study reveals that a client's current dietary intake, while meeting basic macronutrient targets, is leading to suboptimal energy levels and impaired cognitive function during their demanding work schedule. The client, a busy executive, expresses frustration with persistent fatigue and difficulty concentrating, attributing it to stress. As a certified nutrition specialist, CNS, what is the most appropriate next step to address the client's concerns regarding macronutrient metabolism? Option A. Recommend a drastic reduction in carbohydrate intake and a significant increase in fat intake to improve energy utilization, based on general trends in metabolic optimization. Option B. Conduct a detailed assessment of the client's macronutrient ratios, food sources, meal timing, and hydration patterns to identify potential metabolic inefficiencies contributing to their symptoms. Option C. Suggest the client begin taking a broad-spectrum metabolic support supplement to address potential underlying metabolic imbalances. Option D. Advise the client that stress is the primary cause of their symptoms and recommend stress management techniques without altering their current macronutrient intake. Correct answer is B. Conduct a detailed assessment of the client's macronutrient ratios, food sources, meal timing, and hydration patterns to identify potential metabolic inefficiencies contributing to their symptoms. Explanation. The efficiency study reveals that a client's current dietary intake, while meeting basic macronutrient targets, is leading to suboptimal energy levels and impaired cognitive function during their demanding work schedule. The client, a busy executive, expresses frustration with persistent fatigue and difficulty concentrating, attributing it to stress. As a certified nutrition specialist, CNS, the professional's role extends beyond simply ensuring macronutrient adequacy to optimizing nutrient metabolism for enhanced physiological and cognitive performance. This scenario is professionally challenging because it requires the CNS to interpret nuanced metabolic indicators and client-reported symptoms, moving beyond a purely quantitative assessment of macronutrient intake to a qualitative understanding of their impact on the client's daily functioning. The ethical imperative is to provide evidence-based, individualized recommendations that address the root cause of the client's distress, rather than merely accepting their self-diagnosis. The correct approach involves a comprehensive assessment of the client's macronutrient metabolism, considering not just the quantity, but also the quality and timing of intake, and how these factors interact with the client's lifestyle and physiological demands. This includes evaluating the balance of carbohydrates, proteins, and fats, and how they are being utilized for energy production and cellular function. The CNS should consider potential metabolic inefficiencies, such as impaired glucose utilization or inadequate protein synthesis, which could manifest as fatigue and cognitive fog. Recommendations should be tailored to improve metabolic efficiency, potentially through adjustments in macronutrient ratios, food sources, meal timing, and hydration, all within the scope of practice for a CNS, and adhering to ethical guidelines that prioritize client well-being and evidence-based practice. This approach aligns with the CNS credential's emphasis on advanced nutrition assessment and intervention for optimizing health and performance. An incorrect approach would be to dismiss the client's symptoms as solely stress-related and make no changes to their macronutrient intake, despite the study's findings suggesting a metabolic component. This fails to uphold the CNS's responsibility to investigate potential nutritional causes for the client's reported issues and could lead to continued suboptimal health. Another incorrect approach would be to recommend a drastic, unproven dietary overhaul, such as a highly restrictive ketogenic diet or a complete elimination of a macronutrient group, without a thorough assessment of the client's individual metabolic profile, medical history, and potential contraindications. Such an approach could be detrimental to the client's health and violates the principle of individualized, evidence-based nutrition care. Furthermore, recommending specific supplements to boost metabolism without a clear indication of deficiency or specific metabolic dysfunction, and without considering their interaction with macronutrient metabolism, would be outside the scope of practice and potentially unethical. Professional decision-making in such situations requires a systematic process. First, thoroughly gather and analyze all available data, including the efficiency study, client history, and reported symptoms. Second, formulate hypotheses regarding potential metabolic disruptions related to macronutrient metabolism. Third, develop a plan for individualized assessment and intervention, prioritizing evidence-based strategies. Fourth, communicate clearly with the client, explaining the rationale behind recommendations and setting realistic expectations. Finally, monitor the client's progress and adjust the plan as needed, always operating within the ethical and regulatory boundaries of the CNS profession. Question 15. To address the challenge of a client presenting with fatigue, dry skin, and occasional headaches, a certified nutrition specialist, CNS, needs to assess for potential nutrient deficiencies or excesses and evaluate hydration status. Which of the following assessment strategies best aligns with the professional and regulatory expectations for a CNS? Option A. Rely solely on the client's reported symptoms of fatigue and headaches to infer a specific nutrient deficiency. Option B. Focus exclusively on assessing skin turgor to determine hydration status and disregard other potential contributing factors to the client's symptoms. Option C. Immediately recommend a broad-spectrum multivitamin and mineral supplement to address potential underlying deficiencies. Option D. Conduct a detailed dietary history. Perform a comprehensive physical examination focusing on dermatological, oral, and neurological signs, and assess hydration through skin turgor and mucous membrane assessment. Correct answer is D. Conduct a detailed dietary history. Perform a comprehensive physical examination focusing on dermatological, oral, and neurological signs, and assess hydration through skin turgor and mucous membrane assessment. Explanation. Scenario analysis. This scenario presents a professional challenge because the certified nutrition specialist, CNS, must integrate subjective patient reports with objective physical findings to accurately diagnose potential nutrient deficiencies or excesses and assess hydration status. The complexity arises from the overlapping symptoms that can be indicative of multiple conditions, requiring a systematic and evidence-based approach to differentiate and prioritize interventions. The CNS must also consider the ethical imperative to provide safe and effective nutrition care, adhering to the scope of practice and relevant professional guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment that begins with a detailed patient history, including dietary intake, lifestyle, and any reported symptoms. This is followed by a thorough physical examination, specifically looking for dermatological changes, oral manifestations, neurological signs, and edema, which are classic indicators of various nutrient imbalances. Simultaneously, the CNS must evaluate hydration status through skin turgor, mucous membrane moisture, and urine output/color. The integration of these subjective and objective findings, coupled with an understanding of the physiological roles of nutrients and the signs of their depletion or overload, allows for the formulation of a differential diagnosis and the development of an appropriate, individualized nutrition care plan. This approach aligns with the CNS credential's emphasis on evidence-based practice and a holistic understanding of client health. Incorrect approaches analysis. Focusing solely on reported symptoms without a physical examination is an ethical and regulatory failure. It bypasses a critical component of the CNS scope of practice, which includes the assessment of physical signs. This can lead to misdiagnosis and inappropriate recommendations, potentially harming the client. Relying exclusively on a single physical sign, such as dry skin, without considering the broader clinical picture and other potential causes, e.g., environmental factors, other deficiencies, is also a failure. It demonstrates a lack of comprehensive assessment and can result in an incomplete or inaccurate diagnosis. Recommending broad-spectrum supplements without a confirmed deficiency or excess is another significant failure. This practice can be costly, potentially lead to nutrient toxicity, and is not supported by evidence-based nutrition principles, violating the ethical obligation to provide safe and effective care. Professional reasoning. Professionals should approach such situations by first gathering all available subjective information from the client. This is followed by a systematic physical examination, paying close attention to the specific signs and symptoms related to nutrient status and hydration. The CNS should then correlate these findings with the client's history and known physiological pathways. If the assessment suggests a deficiency or excess, further investigation, such as laboratory testing, may be warranted. The decision-making process should always prioritize client safety, evidence-based practice, and adherence to the CNS scope of practice and ethical guidelines. Question 16. Governance review demonstrates that a client undergoing a new, high-intensity training program reports experiencing significant fatigue, muscle cramps, and occasional dizziness, particularly after prolonged exercise sessions. The client has recently adopted a new dietary regimen that is lower in sodium and higher in potassium. The CNS is tasked with evaluating the nutritional implications of these symptoms in the context of the client's new lifestyle. Option A. Advise the client to increase their sodium intake significantly through electrolyte-rich sports drinks and salty snacks to counteract potential sodium depletion, without further medical consultation. Option B. Recommend immediate cessation of the high-intensity training program and advise the client to consult with a physician to rule out underlying medical conditions, given the potential for significant electrolyte imbalances and dehydration. Option C. Provide general advice on the importance of balanced macronutrients and micronutrients for energy production, without specifically addressing the client's reported symptoms or the potential impact of their new dietary regimen on electrolyte balance. Option D. Suggest that the client focus on increasing their fluid intake to at least 1 gallon of water per day to address the dizziness and fatigue, assuming overhydration is not a concern. The correct answer is B. Recommend immediate cessation of the high-intensity training program and advise the client to consult with a physician to rule out underlying medical conditions, given the potential for significant electrolyte imbalances and dehydration. Explanation. This scenario presents a professional challenge because it requires the certified nutrition specialist, CNS, to interpret complex physiological responses to a specific dietary intervention and to apply that interpretation within the strict confines of the CNS credentialing and practice guidelines, which are rooted in U.S. federal and state regulations governing the practice of nutrition and dietetics. The CNS must demonstrate a nuanced understanding of water and electrolyte balance, acid-base homeostases, and the potential for both dehydration and overhydration, as well as electrolyte imbalances, without overstepping the scope of practice defined by regulatory bodies. The core of the challenge lies in distinguishing between general nutritional advice and the provision of medical nutrition therapy, which may require referral to a physician or registered dietitian, RD, depending on the severity of the client's condition and the specific state's laws. The correct approach represents best professional practice because it prioritizes client safety and adheres to the established scope of practice for a CNS. By recognizing the potential for serious physiological derangements and recommending consultation with a physician, the CNS is acting ethically and in accordance with regulatory expectations that prohibit the practice of medicine or dietetics without appropriate licensure or certification. This approach ensures that the client receives the highest level of care, which may involve medical diagnosis and treatment beyond the purview of a CNS. The CNS's role is to provide evidence-based nutritional guidance within their expertise and to identify situations that necessitate a higher level of medical intervention. This aligns with the ethical principles of beneficence and non-maleficence, as well as the legal requirements to practice within one's scope. An incorrect approach that involves directly recommending specific electrolyte repletion strategies without physician oversight fails to acknowledge the potential for misdiagnosis and iatrogenic harm. This could constitute the unlicensed practice of dietetics or medicine, depending on the state's regulations, and violates the ethical duty to avoid harm. Another incorrect approach, such as dismissing the client's symptoms as minor and unrelated to the dietary changes, demonstrates a failure to adequately assess the client's condition and a disregard for the interconnectedness of diet and physiological balance. This could lead to delayed diagnosis and treatment of a serious underlying issue, violating the principle of non-maleficence. Furthermore, an approach that focuses solely on general hydration advice, without considering the specific electrolyte disturbances indicated by the symptoms, overlooks the critical role of electrolytes in maintaining fluid balance and cellular function, potentially leading to ineffective or even harmful recommendations. This demonstrates a lack of comprehensive understanding of water and electrolyte balance as a complex physiological system. Professional decision-making in such situations requires a systematic process. First, a thorough assessment of the client's reported symptoms and their potential physiological underpinnings. Second, an evaluation of whether the observed symptoms fall within the scope of practice for a CNS. Third, a determination of whether the situation warrants referral to a physician or other licensed healthcare professional. And finally, the provision of appropriate nutritional guidance within the CNS's scope, while clearly communicating the limitations of that scope and the necessity of medical consultation. This iterative process ensures that client well-being is paramount and that all actions are compliant with regulatory frameworks and ethical standards. Question 17. The monitoring system demonstrates a consistent pattern of low iron levels in a toddler, confirmed by recent laboratory results. The parent expresses strong reservations about iron supplementation, citing anecdotal evidence from a social media group suggesting potential harm and preferring to rely solely on dietary sources they deem natural. The Certified Nutrition Specialist, CNS, is tasked with developing a nutrition care plan. Which of the following approaches best aligns with professional ethical guidelines and regulatory expectations for a CNS in this situation? Option A. Provide the parent with a list of iron-rich foods and instruct them to strictly adhere to these dietary recommendations, dismissing their concerns about supplementation as unfounded. Option B. Proceed with prescribing a high-dose iron supplement without further discussion, assuming the parent will eventually comply once they see the child's condition improve. Option C. Engage in a detailed discussion with the parent about the scientific evidence supporting iron supplementation for iron deficiency anemia in toddlers. Explore their specific concerns about supplementation, and collaboratively develop a plan that may include both dietary strategies and a carefully considered supplementation regimen, while emphasizing the importance of addressing the deficiency to prevent developmental impacts. Option D. Immediately document the parent's refusal of supplementation and recommend reporting to Child Protective Services due to the potential for ongoing harm to the child's development. The correct answer is C. Engage in a detailed discussion with the parent about the scientific evidence supporting iron supplementation for iron deficiency anemia in toddlers. Explore their specific concerns about supplementation, and collaboratively develop a plan that may include both dietary strategies and a carefully considered supplementation regimen, while emphasizing the importance of addressing the deficiency to prevent developmental impacts. Explanation. This scenario presents a professional challenge due to the potential conflict between a parent's expressed beliefs and the evidence-based nutritional recommendations for a child, particularly concerning a common childhood nutritional problem like iron deficiency anemia. The Certified Nutrition Specialist, CNS, must navigate this situation with sensitivity, ethical consideration, and adherence to professional practice guidelines, which are rooted in the regulatory framework governing nutrition professionals in the United States. The correct approach represents best professional practice because it prioritizes the child's well-being by gathering comprehensive information, educating the parent on the risks and benefits of interventions, and collaborating to develop a personalized plan. This aligns with the ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, as well as the professional responsibility to provide evidence-based care. The CNS is expected to act as a trusted advisor, empowering parents with knowledge to make informed decisions, while ensuring the child's nutritional needs are met according to established pediatric guidelines. An incorrect approach that focuses solely on the parent's immediate request without further investigation fails to uphold the duty of care. This could lead to the child's iron deficiency anemia worsening, potentially causing long-term developmental issues, which is a violation of the principle of beneficence. Furthermore, it neglects the professional obligation to provide accurate, evidence-based information and guidance. Another incorrect approach that involves immediately overriding parental consent and reporting to Child Protective Services without exploring less restrictive interventions is premature and potentially damaging to the parent-professional relationship. While child welfare is paramount, such drastic measures should be a last resort after all other avenues for education, collaboration, and support have been exhausted. This approach could be seen as a failure to respect parental autonomy and could erode trust, making future interventions more difficult. It also risks misinterpreting the situation and causing unnecessary distress. A third incorrect approach that involves dismissing the parent's concerns and rigidly adhering to a single dietary recommendation without considering the family's cultural or personal beliefs fails to acknowledge the complexity of nutritional counseling. While evidence-based practice is crucial, effective nutrition interventions require a client-centered approach that respects individual circumstances. This can lead to non-adherence and a breakdown in the therapeutic relationship, ultimately hindering the child's nutritional progress. The professional decision-making process for similar situations involves a systematic approach. 1. Assessment. Thoroughly assess the child's nutritional status, including reviewing medical history, dietary intake, and relevant lab results. 2. Information gathering. Understand the parent's concerns, beliefs, and any cultural factors influencing their decisions. 3. Education. Provide clear evidence-based information about the child's condition, the importance of specific nutrients like iron, and the potential consequences of deficiencies. 4. Collaboration. Work collaboratively with the parent to develop a realistic and achievable nutrition plan that addresses the child's needs while respecting their values. 5. Intervention and monitoring. Implement the plan and closely monitor the child's progress, making adjustments as necessary. 6. Escalation if necessary. If the child's health is at significant risk and the parent remains unwilling or unable to comply with essential recommendations, consider appropriate escalation pathways, which may include consulting with the child's pediatrician or, in severe cases, reporting to Child Protective Services, but only after exhausting all other options. Question 18. System analysis indicates that a certified nutrition specialist, CNS, has utilized dietary analysis software to assess a client's typical daily intake. The software has generated a comprehensive report detailing macronutrient and micronutrient consumption relative to the client's estimated energy requirements and various dietary reference intakes. Dry. The CNS needs to translate this complex data into a clear and actionable plan for the client. Which of the following represents the most appropriate approach for the CNS to optimize the process of interpreting and utilizing this nutrient data? Option A. Prioritize the interpretation of macronutrient distribution, e.g., percentage of calories from carbohydrates, fats, and proteins, as this is the most significant factor in overall dietary adequacy, and de-emphasize micronutrient analysis unless explicitly flagged as critically low by the software. Option B. Provide the client with a generic list of foods that are high in nutrients identified as potentially low by the software, without considering the client's food preferences, cultural background, or the overall dietary context of their intake. Option C. Critically evaluate the software's output in conjunction with the client's individual health goals, medical history, and lifestyle, using the DRIs as a benchmark to identify specific nutrient patterns and potential areas for improvement, and then develop personalized, evidence-based recommendations. Option D. Focus on presenting the raw numerical data from the software, highlighting any values that fall outside the software's preset normal ranges, and advising the client to adjust their intake based solely on these flags. The correct answer is D. Focus on presenting the raw numerical data from the software, highlighting any values that fall outside the software's preset normal ranges, and advising the client to adjust their intake based solely on these flags. Explanation. This scenario presents a common challenge for certified nutrition specialists, CNS, in the United States, interpreting complex dietary software output to ensure client dietary adequacy while adhering to U.S. regulatory frameworks and ethical guidelines. The challenge lies in moving beyond simply reporting numbers to providing actionable, evidence-based recommendations that align with established dietary reference intakes, DRI, and are ethically communicated. The correct approach emphasizes a holistic interpretation of the dietary analysis software's output, integrating it with the client's individual needs, health status, and the established DRIs. This involves critically evaluating the data, identifying potential nutrient gaps or excesses, and then formulating personalized recommendations that are both scientifically sound and practical for the client to implement. This aligns with the CNS credential's commitment to evidence-based practice and ethical client care, as outlined by the Board for Certification of Nutrition Specialists, BCNS, Code of Ethics, which mandates competence, integrity, and acting in the client's best interest. It also implicitly adheres to the principles of the Dietary Supplement Health and Education Act, DSHE, by focusing on dietary intake and not making unsubstantiated claims about supplements. An incorrect approach would be to solely rely on the software's automated flags or to present raw data without context or interpretation. This fails to demonstrate the professional judgment and critical thinking expected of a CNS. Ethically, it could lead to misinformed clients who may over or underconsume certain nutrients, potentially impacting their health. Regulatory failure would occur if the interpretation leads to recommendations that are not supported by scientific evidence, or that could be construed as making therapeutic claims without proper qualification, which could fall afoul of FDA regulations regarding health claims. Another incorrect approach is to present the data in a way that is overwhelming or confusing to the client, failing to meet the ethical obligation of clear and understandable communication. This can undermine client adherence and trust. The professional decision-making process should involve 1. Understanding the client's goals and health status. 2. Critically reviewing the dietary analysis software output, cross-referencing with established DRIs and scientific literature. 3. Identifying key areas of potential concern, deficiencies, excesses, imbalances. 4. Translating the data into clear, actionable, and personalized recommendations. 5. Communicating these findings and recommendations effectively to the client, ensuring comprehension and addressing any questions. This systematic approach ensures that the CNS is providing competent, ethical, and evidence-based nutrition care within the U.S. regulatory landscape. Question 19. Consider a scenario where a 15-year-old competitive swimmer presents for nutrition counseling. They report feeling constantly hungry, experiencing energy crashes during practices, and express concerns about their body composition affecting their performance. They also mention occasionally skipping meals when feeling stressed about schoolwork. As a certified nutrition specialist, what is the most appropriate initial approach to address this client's needs? Option A. Focus on educating the adolescent about the importance of hydration for athletes and provide general guidelines for pre- and post-exercise nutrition without delving into their specific eating patterns or any potential psychological factors. Option B. Immediately develop a high-carbohydrate, high-protein meal plan designed to maximize energy levels for swimming and promote muscle recovery, focusing solely on macronutrient targets to improve performance. Option C. Advise the adolescent to reduce their overall calorie intake to achieve a leaner body composition, as this is often a goal for swimmers, and suggest they focus on clean eating by eliminating processed foods. Option D. Conduct a comprehensive dietary assessment, including a 24-hour recall and food frequency questionnaire, screen for disordered eating behaviors using validated tools, and inquire about their training schedule, energy expenditure, and perceived hunger and fullness cues, while also exploring their stress management strategies and relationship with food. The correct answer is D. Conduct a comprehensive dietary assessment, including a 24-hour recall and food frequency questionnaire, screen for disordered eating behaviors using validated tools, and inquire about their training schedule, energy expenditure, and perceived hunger and fullness cues, while also exploring their stress management strategies and relationship with food. Explanation. Scenario analysis. This scenario presents a professional challenge due to the sensitive nature of adolescent eating disorders, the potential for misinterpretation of nutritional needs in a sports context, and the ethical imperative to provide evidence-based, individualized care within the scope of practice for a certified nutrition specialist, CNS. Adolescents are a vulnerable population, and their nutritional requirements are dynamic, influenced by growth spurts, hormonal changes, and physical activity levels. The intersection of these factors with potential disordered eating patterns requires a nuanced and cautious approach, prioritizing the client's well-being and safety above all else. A CNS must navigate the complexities of differentiating between normal adolescent appetite fluctuations, athletic training demands, and the early signs of an eating disorder, all while adhering to professional ethical standards and regulatory guidelines. Correct approach analysis. The correct approach emphasizes a comprehensive, client-centered assessment that integrates the adolescent's reported eating habits, athletic performance goals, and psychosocial context. This aligns with the CNS scope of practice, which mandates thorough evaluation before developing any intervention plan. Specifically, it requires screening for disordered eating behaviors, assessing for potential nutrient deficiencies or excesses related to sports, and understanding the psychological and social factors influencing the adolescent's relationship with food and their body. This approach prioritizes safety by recognizing the potential for underlying eating disorders and the need for appropriate referral if necessary, ensuring that nutritional recommendations do not inadvertently exacerbate or mask these issues. It reflects best professional practice by adhering to the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the CNS Code of Ethics, which stresses the importance of accurate assessment and appropriate scope of practice. Incorrect approach is analysis. One incorrect approach might involve immediately implementing a high-carbohydrate, high-protein meal plan solely focused on optimizing athletic performance, without a thorough assessment of the adolescent's current eating patterns or any potential disordered eating concerns. This fails to acknowledge the potential for underlying eating disorders, which could be exacerbated by aggressive performance-focused nutrition strategies. It violates the principle of non-maleficence by potentially causing harm if the adolescent is restricting or engaging in compensatory behaviors. Furthermore, it oversteps the bounds of responsible practice by assuming a purely athletic nutrition need without a comprehensive evaluation. Another incorrect approach could be to solely focus on the perceived unhealthy eating habits without considering the adolescent's developmental stage, athletic demands, or the possibility of an eating disorder. This might lead to restrictive recommendations that could be detrimental to growth and development, or that fail to support athletic needs, potentially causing harm and undermining the client's trust. It also risks misinterpreting normal adolescent appetite changes or athletic fueling needs as problematic, leading to unnecessary anxiety and potentially contributing to disordered eating. A third incorrect approach might be to dismiss the adolescent's concerns about their body image or eating habits as typical teenage behavior and proceed with generic sports nutrition advice. This neglects the critical responsibility of a CNS to screen for and recognize the signs of eating disorders, which can have severe health consequences. Failing to address potential disordered eating behaviors is a significant ethical lapse and a failure to act in the client's best interest, potentially allowing a serious condition to progress undiagnosed and untreated. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough, holistic assessment. This involves active listening, open-ended questioning, and the use of validated screening tools for eating disorders. The CNS must then integrate information regarding the adolescent's growth, development, activity level, and psychosocial context. If red flags for disordered eating are identified, the priority shifts to appropriate referral to mental health professionals specializing in eating disorders, while continuing to provide supportive, non-stigmatizing nutritional guidance within the scope of practice. For athletic performance, recommendations should always be individualized, evidence-based, and integrated with the overall health and well-being of the adolescent, ensuring that fueling strategies support, rather than compromise, their physical and mental health. Question 20. The investigation demonstrates a client presenting with persistent fatigue, frequent urination, and unexplained weight loss. The client's medical history includes a family history of type 2 diabetes. The certified nutrition specialist, CNS, is tasked with evaluating the client's carbohydrate metabolism and recommending appropriate nutritional strategies. Which of the following approaches best reflects the CNS's role and responsibilities in this scenario? Option A. Recommend a low-carbohydrate ketogenic diet to rapidly reduce blood glucose levels and initiate weight loss, while advising the client to monitor their blood glucose with a home testing kit. Option B. Conduct a comprehensive nutritional assessment, including detailed dietary recall of carbohydrate intake, physical activity levels, and symptom patterns, and then develop an individualized nutrition plan focusing on balanced macronutrient distribution, fiber intake, and glycemic load, while collaborating with the client's physician for medical management. Option C. Prescribe a specific dosage of metformin to manage the client's suspected pre-diabetic state based on the family history and reported symptoms, and instruct the client on its usage. Option D. Advise the client to eliminate all forms of sugar from their diet immediately and suggest a high-protein, low-fat diet to prevent potential complications related to carbohydrate metabolism. The correct answer is A. Recommend a low-carbohydrate ketogenic diet to rapidly reduce blood glucose levels and initiate weight loss, while advising the client to monitor their blood glucose with a home testing kit. Explanation. The investigation demonstrates a scenario where a certified nutrition specialist, CNS, must navigate complex metabolic pathways and their clinical implications, specifically concerning carbohydrate metabolism. The professional challenge lies in accurately assessing a client's condition, understanding the interplay of various metabolic processes, and recommending appropriate interventions based on scientific evidence and ethical practice, all within the scope of the CNS credential. This requires a deep understanding of glycolysis, gluconeogenesis, glycogenolysis, the citric acid cycle, the pentose phosphate pathway, and the hormonal regulation of these processes, as well as common metabolic disorders like diabetes mellitus and glycogen storage diseases. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the client's physiological state and dietary intake. It involves integrating knowledge of carbohydrate metabolism to identify potential dysregulations and formulating a personalized plan that addresses the root causes of the client's symptoms. This aligns with the CNS scope of practice, which emphasizes the application of nutritional science to optimize health and manage disease through individualized nutrition intervention. Ethical practice dictates that the CNS must act within their expertise, utilize current scientific literature, and prioritize the client's well-being. Incorrect approaches fail to meet professional standards due to several regulatory and ethical failures. One incorrect approach might involve making a diagnosis or prescribing medical treatment, which falls outside the scope of practice for a CNS and infringes upon the domain of licensed medical professionals. This is a direct violation of professional boundaries and potentially harmful to the client. Another incorrect approach could be relying on anecdotal evidence or unverified information, which disregards the scientific rigor expected of a CNS and can lead to ineffective or detrimental recommendations. Furthermore, an approach that fails to consider the client's individual metabolic profile, genetic predispositions, or lifestyle factors, and instead applies a one-size-fits-all dietary strategy is ethically unsound and professionally negligent, as it does not meet the standard of individualized care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough client assessment. Gather detailed history, including dietary intake, lifestyle, symptoms, and relevant medical information. 2. Knowledge application. Apply current scientific understanding of carbohydrate metabolism and related disorders. 3. Differential diagnosis consideration. Identify potential metabolic imbalances or disorders based on the assessment. 4. Evidence-based intervention planning. Develop a personalized nutrition plan supported by scientific literature. 5. Collaboration and referral. Recognize limitations and refer to other healthcare professionals when necessary. 6. Ongoing monitoring and adjustment. Continuously evaluate the effectiveness of the intervention and make necessary modifications. 7. Ethical adherence. Ensure all actions are within the CNS scope of practice and adhere to ethical guidelines.